The cystic fibrosis community is invited to participate in a series of videos and podcasts on individuals that are living, breathing, succeeding with cystic fibrosis. This video, Clear the Airways, was made possible through an unrestricted educational grant from Genentech to the Boomer Esiason Foundation. Today you will see various methods of airway clearance, with the goal always being stay clear to avoid lung infection. First form of airway clearance is the vest. The vest is a great way to start shaking up the lungs and move the secretions up. I like to use the vest in the morning and at night when I'm inhaling my medications. It's also a great way to multitask. So as I'm inhaling my medications, I'm also doing the vest, and the vest helps move the secretions up so I can cough them out. Also, while I'm doing the vest, I can do some reading and do a little work on the computer. Another form of airway clearance is the Flutter. As you can see, this is a very compact device. There's a little ball inside that makes little oscillations and kind of rumblings inside your lung as you exhale. I use the Flutter normally 4 or 5 times a day. I carry it with me in my backpack. I use it in the car when I'm driving, and it's a great little device that helps keep the lungs clear. Another device that I found online is called the PowerLong. The PowerLong, like the Flutter, pushes the secretions up, but it adds a little bit more resistance. The PowerLong has different strengths, and you can adjust the strength on each one. There's one for beginners, there's one for people that exercise, and there's another one for advanced. And these are all color-coded, and I find them to add a little bit more resistance than the Flutter. A lot of people with cystic fibrosis do get infections throughout their sinuses. So I do sinus irrigation, and it helps clear my sinuses. We also have the percussor. It's great for isolating different lobes in various parts of the lung. The great thing about the percussor is that it has different adjustments, so you can adjust the power depending on how you feel, depending on your area that you're having some problems with congestion. But you can turn up the volume and it gets really strong, or you can turn it down. You can use the percussor in various positions, and it's great for travel. I really like the percussor because I can isolate different areas of my lungs, and especially depending on where I'm feeling more congestion, the right side, left side, upper, lower, I can really isolate it, as you can see here, to really try to clear out that area of my lungs. Lastly, and probably the most important thing in my life to stay clear, is exercise and being active. Exercise and being active really helps clear out the lungs. When I'm out there jogging, I cough up and spit out a lot of the mucus, but it's really all about staying clear and being active. Even with oxygen, I continue to stay active before transplant. If I sit around and I'm not active, like sitting around on the couch, what's going to happen is the mucus is just going to build up, and then if I do get a cold or infection, it just builds up more and more, and it's harder and harder to breathe. So as you can see, there's a lot of forms of airway clearance, and the best thing is that I suggest is check with your doctor and see what he or she suggests for you.